Welcome to Vet NeuroJar, where we explore the fascinating intersection of veterinary neurology and wildlife health. Today, we're tackling a persistent threat to our feathered friends, lead toxicosis, also known as lead poisoning. To kick us off, why is lead such a widespread concern for birds?
Well, lead is a pervasive environmental contaminant and, critically, it has no known biological function. This means it serves no purpose in living organisms and is purely harmful. Environmental lead contamination is documented to cause toxicosis in various wildlife species, including birds, mammals, amphibians, and reptiles. Now, where do birds typically encounter this lead in their environments?
Birds encounter lead through various sources, including urban environments, paint, fuel, mining, batteries, contaminated soil, fishing gear, and lead shot from hunting ammunition. Which types of birds are the most vulnerable to lead poisoning?
Avian scavenger species, such as birds of prey, are particularly susceptible because they ingest spent ammunition while feeding on carcasses or wounded animals. Waterfowl are also at risk, as they may ingest spent ammunition or lead tackle, mistaking it for grit in water sediment. That paints a concerning picture. Is there data that shows how serious the issue is?
Yes, a retrospective study was conducted at a wildlife rehabilitation center in Wisconsin from 2014 to 2023, examining 95 avian cases treated for lead toxicosis. The study aimed to evaluate lead intoxication in wild birds, considering factors like species, blood lead levels, clinical signs, and treatment outcomes. What were the major findings of this study?
The study revealed that a low blood lead level, less than 20 G/dl, was the most commonly diagnosed level. However, neurologic issues were more prevalent in birds with higher blood lead levels, while poor body condition, trauma, and anemia were more common in birds with low lead levels. Bald eagles and tundra swans were the most frequently presented species. Furthermore, birds with intake blood lead levels exceeding 60 G/dl had a higher likelihood of death or euthanasia. So, even low levels of lead have significant health impacts. How does lead affect birds internally?
The amount of lead absorbed varies based on exposure route, particle size, and the acidity of the bird's gastrointestinal tract. Lead is absorbed in the small intestine and enters systemic circulation. Approximately 6% of systemic lead is stored in soft tissues, blood, muscle, nervous system, with the remaining 94% stored in bone. It sounds like lead accumulates in their bodies over time, causing long-term issues.
Yes, and the effects can differ among species. For example, bald eagles are more sensitive to lead toxicosis compared to other avian species. What specific clinical signs do veterinarians and rehabilitators look for when diagnosing lead poisoning?
Clinical signs are categorized into neurologic, gastrointestinal, and hematologic signs. Birds with acute lead toxicity may exhibit hind limb paresis, depression, visual impairment, labored breathing, and bright green feces, often with severely elevated blood lead levels. Chronic lead toxicity may present as poor body condition, weakness, anemia, and depression, with blood lead levels typically between 60 and 100 G/dl. Bright green feces seem like a key symptom. Is that reliable?
While it is a sign of lead toxicity in birds, it's not always present. The study found it in a small percentage of cases, mainly in bald eagles, Canada geese, and tundra swans. So how is lead toxicosis definitively diagnosed in live birds?
Blood lead concentration testing is essential. Gold standard methods include graphite furnace atomic absorption spectrometry and inductively coupled plasma mass spectrometry. Portable point-of-care lead analyzers are also used for their convenience and low cost. What treatment options are available once a bird is diagnosed with lead poisoning?
Treatment is tailored to the individual and includes removing metallic foreign bodies from the GI tract via endoscopy, forced casting, or gastrotomy. And chelation therapy. Can you explain chelation therapy?
Chelation involves drugs that bind to lead, helping the body eliminate it. Common treatments include injectable calcium disodium EDTA, CK, and oral dimercaptosuccinic acid, DMSA. Lead accumulation in bone and soft tissues can complicate treatment, causing fluctuating blood lead levels as lead is redistributed. Does the study indicate which treatments are most effective? The study found that all chelation methods, CK, DMSA, or a combination, effectively reduced blood lead levels. What are the specific treatment protocols based on lead levels?
For blood lead levels between 10 and 20 G/dl, DMSA was used if the GI tract was functioning. Above 20 G/dl, injectable CADTA was initiated. A combination of DMSA and CADTA was used for levels greater than 65 G/dl.
How long do these treatments last?
Treatment protocols lasted from 4 to 17 days, followed by a 48-hour washout period before rechecking blood lead levels. Chelation continued until levels were below 10 G/dl or until the patient died or was euthanized. The study also examined hematology results in these birds, correct?
Yes, approximately 39% of birds with elevated lead levels were anemic. Most anemic patients had low blood lead levels. Polychromasia, indicating red blood cell regeneration, was present, particularly in bald eagles. Basophilic stippling, another red blood cell abnormality, was rare. So the hematological changes can be variable. What influenced the outcome for birds being treated for lead poisoning?
Initial blood lead level is critical. Levels above 60 G/dl indicate a poorer prognosis. The presence of neurologic disease also indicates a higher likelihood of a negative outcome. Species, clinical signs, and radiographic changes all help guide clinical decisions. What are the limitations of the study?
Limitations include the retrospective nature of the study and difficulties in separating lead toxicosis effects from other comorbidities in wild patients. Blood lead levels indicate acute exposure rather than long-term exposure, which can be a confounding factor. The data is also from a single rehabilitation center in Wisconsin, which may not represent all regions. What are the key takeaways from this research?
The study emphasizes that lead toxicosis remains a significant threat to wild birds, especially bald eagles and waterfowl. Neurologic signs are common in birds with high lead levels, and high blood lead levels indicate a poor prognosis. Chelation therapy, using both CADTA and DMSA, is effective in reducing blood lead levels. What steps can be taken to prevent lead toxicosis in wild birds?
Reducing environmental lead contamination is crucial. This includes promoting the use of non-lead ammunition and fishing tackle. Education for hunters and anglers about the dangers of lead is essential. Wildlife rehabilitation centers play a vital role in treating affected birds and gathering data. That concludes our discussion on lead toxicosis in avian species. Thank you for tuning in to Vet Neuro Jar. Keep those minds inspired, hearts light, and tails wagging.